Hi, good afternoon, everybody. I'm Jody Hanson, Director of Public Affairs and Communication for Johnson County Government. With us today is Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. And we have Elizabeth Holschuh, who is our Director of Epidemiology. Thank you also to Allison, who is our ASL interpreter today. Dr. Ariola, I think it's always a good start to talk about how today's clinic went.
Thank you, Jody. Good afternoon, everyone. Clinic went pretty well today. Today was a first dose clinic at Okun. We made arrangements to vaccinate 1,600 persons, ended up vaccinating just under 1,400. We debriefed with staff earlier on. It went pretty well. The flow was pretty good. Feedback from our residents have been excellent. So that's going on. Tomorrow and Friday, we do have largely second dose clinics, but we've added additional appointments, 500 each for tomorrow and Friday for first doses. Again, continuing to vaccinate in our phase 2, 65 plus and other parts of phase 2. And I know that later Elizabeth will get into some of the recent efforts to look at the gaps there and how we are going to fill those gaps and ensure that everyone is given an opportunity to get vaccinated. So our clinics run pretty well. And next couple of days, we expect it to run well too. And that's going to be in Okun. And following week, we are really excited about the opportunity to move to a new location, a fixed location. Obviously, next week, we're going to be running clinics simultaneously at Okun, largely second doses and first doses at our new location. And we should be opening up appointments for those by tomorrow to vaccinate. But our staff are excited, our staff are ready, and we'll continue to vaccinate as much as we can. The other big news, obviously, earlier in the week, is the announcement from Governor Kelly that the state would move to phases 3 and 4 on Monday, and we would be ready to do that, and we'll move accordingly, meaning that the appointments that we have next week will be open to those that remain from phase 1, those that remain from phase 2, and phases 3 and 4. I do want to say that to the extent to which we can, we will have a special focus still to finish up 65 plus and the rest of phase 2. And we're thinking through a few other ways. Our health systems, our partners, are currently vaccinating in phase 2. They have appointments open to vaccinate grocery store workers, retail store workers, restaurant workers, and others that qualify in phase 2, especially the 65 plus. And not just our health systems, our pharmacists, to the extent to which they have vaccines, are also vaccinating in that group. And we are looking at additional options. And as soon as those are finalized, we will make those available. We are looking at targeted vaccinations. I'd mentioned, Elizabeth will talk a little bit more about the 65 plus, but we're also working on some of those for other groups in phase 2. The one thing, tomorrow, we do have what we're calling transportation clinic at SDOB building tomorrow for those that need transit help. And again, I do want to commend Josh Powers and his team for working with our team to get that going. That is, I believe they're going to be transporting about 16, 17 people to the clinic tomorrow and vaccinating them. And that's really good development. And like we shared recently, our homebound group are out there vaccinating. Last week, I think they did just under 30 vaccinations combined. This week, they have 2 teams that are going separately, and they're vaccinating. And those are the things that are being done in addition to the clinics that we run, and in addition to what our health systems and pharmacists are doing. And so we're, again, trying to see where the gaps are. And what I should add to that transportation clinic is that by tomorrow after the clinic, we expect that everyone that is 65 plus that has indicated to us that they need help with transportation would have been vaccinated. And so, and our staff with the homebound group are now going to be also working with the area agency on aging, on reaching out even to more of our population who are homebound and get vaccines into their arms. There's a couple of really good pictures that we had. I believe that we showed them the last time with residents who are homebound, who are so happy to get the shot and say, hey, you can take my picture and show. Those are really good good stories in the midst of this really hard work and difficult work that's been ongoing. So that's what we want. We want the shot in the arms of people, and that's going very well. So Elizabeth pulled out some numbers today that are very encouraging. Will you just start us off by talking through what the numbers are saying?
Absolutely. Thank you, Dr. Ariola. So we received a report from KDHE today, and it looks like we're going to start getting this every Wednesday, which is very exciting. It's more comprehensive than what we have been able to pull ourselves and identify ourselves. And what we're seeing is that we have approximately 180,000 Johnson County 180,000 doses that have been administered to Johnson County residents. And that equates to about 117,000 individuals who have received the vaccine. And that's right about 1 in 5 of Johnson County residents have had at least one dose of one of the coronavirus vaccines. And again, that's either through us or through our partner or in other locations throughout the state. So 1 in 5 is really outstanding. We've also been looking at our 65 and up population. As you all know, this has been a really big push for us to make sure that we are protecting them because they are the most vulnerable for the most part in terms of severe outcomes from this disease. So really vaccinating them, protecting them, preventing them from needing to go to the hospital if they get exposed or possibly dying from this disease. And what we have found is that about 2/3 of our Johnson County residents 65 and up have had at least one dose. So just about 66%. And nearly 1/3 of our residents 65 and up are fully immunized, a little over 30%. So we have really been making some great progress, but we know that there are some more individuals who are in that age group who have not been vaccinated. And in order to really try and capture this, if you're over 65 and filled out our interest survey, may have received a text message from us this week or a phone call or an email where we asked you just to let us know what your status was. Have you received your vaccine? Are you fully vaccinated? Are you waiting on your second dose? Have you not gotten a chance to get vaccinated yet? Or maybe you've just changed your mind and you're not interested. And we do have about 3,500 Johnson County residents over the age of 65 who have yet to get their vaccine. And so our push will be this coming week as we start looking to open up into the additional phases to really get those individuals in and continue to work them in as it is such a vulnerable group for severe outcomes from this disease. So even though we still have this 3,500 person group of over 65 who have not yet been vaccinated, I think the fact that we have 2/3 of our residents in that age group who have at least one dose, which is really very effective, and almost 1/3 who are fully protected is great news. And as we move into the coming weeks, I'm sure that we will start increasing that fully vaccinated percentage. So heading in the right direction, definitely.
Thank you, Elizabeth. And just to, again, those are very important points that about 1 in 5, just close to 20%. And again, by the time you add this week's number and the numbers that are not being reported, really we're saying 20% of our population will have received at least one dose of the vaccine. And that's big. And she's also saying that in our 65 plus category, about 65% have received the first dose. So we are making progress. We expect those numbers to go up this week and next week. And we'll continue to chip away at this with us, with our partners, and would be doing all we can to fill in the gaps. The interest from our residents to take the vaccine continue to be very impressive. Here's the other thing is, even as we are preparing to move into the next phase, phases 3 and 4, outside of our clinics are the many other activities that we're doing. We are, for example, working to vaccinate workers in specific industries. We have some large employers that are we're providing vaccines to be vaccinated. Like we said last week, we are providing vaccines for those in our corrections facility. But we're also doing that. So today we have just finalized efforts to arrangements to vaccinate our educators in our higher education institutions. So all of those have been, so if you work in any of those higher education institutions, your employer should be reaching out to you, and those vaccinations should occur or start at the beginning of April as part of the move to phase 3 and 4. We're also working with some of our utility companies, some of those employers that are here to also vaccinate their employees. So there's a lot of vaccinations and activities that are ongoing, even outside of the clinics, that is allowing us to move quicker towards achieving the goal of broadly vaccinating in the county.
Yeah, you know, while you were talking, Dr. Ariola, like I often do, I was running some numbers on my end. You know, the 1 in 5, or that 20% that we were talking about, is our entire population. But this vaccine is really only licensed. Only one of our vaccines is licensed for 16 and up. And so if we look at that population, so people who are eligible to even receive the vaccine, we're actually closer to 1 in 4 of our residents. So just at 25% of our residents have received at least, of our adults population have received at least one vaccine. So it's really great to see the progress on these numbers and to really understand that we're moving very quickly to getting a large proportion of our population immunized.
And thank you so much for clarifying that. So our denominator should not be our entire population, but for those who qualify. And when you use that, makes absolutely sense. We're probably talking about 450,000 persons that will be eligible, roughly.
About 475,
yeah. Yeah, okay.
That's great news.
Pretty good, yeah.
Good progress. Just a quick question. So higher education institutions, you talked about those vaccinations beginning in April. So if somebody works for like a, KU Edwards campus or Johnson County Community College and they want the vaccination, what should they do? What should they be doing right now, if anything?
They should simply wait to hear from their employers. I can tell you that if you work for KU Edwards, or if you have to be Johnson County resident, or you work for KU Medical Center, as a Johnson County resident, you are going to be vaccinated by KU Med, guys that we've been working with. If you work for Johnson County Community College, you are going to be vaccinated by Advent Health. If you work for KSU Olathe, and you are going to be, and I'm going to miss some, just trying to run that off my head, you are going to be vaccinated by Olathe Health. And I think Olathe Health is added a few others. So I'm sure I'm missing some. There's a few other institutions, but virtually all of them we have made arrangements with. They're going to be, their employers will reach out to them. They'll be able to book appointment with some of our partners. Again, our goal is to begin that in April. And the vaccine will be available to, we just really finished a meeting with all of our health systems before we came in here. And everybody's excited and ready to go. And if you're wondering, that's not just, they're going to be doing this in addition to the vaccinations that they're already carrying out. So it's not taking away, well, these are part of phases 3 and 4 anyway, but that's in addition to what they're currently doing. Just like we are looking to expand and create more appointments, they're also doing the same thing in preparation for more vaccines coming into the county. That's still one variable that is always there. Is we are able to do all of this, or the pace at which we're able to do them depends on how many vaccines we're getting.
And so okay, so the people that work for those institutions should wait to hear from their employers.
Yes.
And I would assume that those employers are making their own plans as far as maybe how they're prioritizing, just like the school, the K through 12 did. Is that correct?
I'm sure there will be, because we saw the numbers, the estimate of the number of persons that needs to be vaccinated, and there's the people will have to be prioritized. Things will have to be staggered, and those are the things that they would have to do with the health systems that's handling their vaccinations. Of course, some of the institutions have higher numbers of Johnson County residents than others. So for some might be easier to do. For others, it could take a few days to get those done.
That's great news. Was there anything else you wanted to cover before we took some questions from social media?
I think those are the key points. Those are the key points we wanted to share. One, that we're going to be moving to including phases 3 and 4, just like the governor said, next week. And that we're moving to our new location. So we're going to be running clinics at both sites next week. So be sure of where your appointment is. If it's a second dose, you are going to be in Oakland Fieldhouse. If it is first dose, you will be at the new location at Lenexa. We are going to be providing more information tomorrow and Friday. Your appointment document will have the details of where you need to be, and when you need to be there, and at what time you need to be there. And so, so that is that. But again, those are the key points, and the numbers, like Elizabeth shared, very encouraging.
Okay, great. Thanks to both of you. We have a question here on Facebook. Someone is asking about the fact that I think all the websites that she's looking at still say 65 and up. It doesn't seem to be open to 65 and younger yet. And is that just because that's just where we are as of this week, would you say?
Yes, we don't move to phase 3 and 4 until Monday. So the appointments that are available and details are still for phase 2. But from Monday, we move to phases 3 and 4. And that's when you will have the opportunity to do that.
Okay. And then somebody is asking, will the hospitals and the pharmacies also be moving to phases 3 and 4?
Yes. Yes.
We have a question. When can we fill the interest form for phases 3 and 4?
Right now, if you go to jocogov.org/interest survey, you can absolutely fill out your information. I was just checking with my team, and we have about 35,000 responses so far to that survey. And so if you have not yet filled out a survey with us and you are interested in receiving the vaccine, whether you have pre-existing conditions or not, if you are in a prioritized sector or profession or not, it doesn't matter. If you are a Johnson County resident or you work in Johnson County and are interested in receiving the vaccine, please go to jocogov.org/interest survey and fill that out. And that is how we will begin inviting people to receive appointments.
We have someone asking kind of a pretty specific question. It's somebody that's really concerned. They want to know about the safety of getting the vaccine. This is for what if somebody had a twin that passed away after getting a flu shot. So there's a lot more detail in the question as far as that condition. But I guess what would you say overall if someone has kind of a specific question about, is the vaccine safe for me because of this condition?
Right, pretty straightforward. Consult with your primary care physician.
Okay, we're sorry to hear that story. Will people in phase 3 be automatically notified for an appointment if they have filled out the interest form?
Yes, they will. So that is how we will begin inviting people for vaccine appointments, is through the individuals who have filled out our interest form. So once you fill that out, you don't need to do anything else. Wait for us to let you know. But also, as we move into phase 3 and 4, as Dr. Ariola said, feel free to look at our partners, the healthcare systems, our pharmacy partners, and see if you are able to obtain a vaccine at any of those locations as well. Certainly we will be opening it up and inviting you all, but if you're able to find it somewhere else, definitely go ahead and do that.
Okay. We have someone that actually asked a two-part question. What is your goal for the number of vaccines that you want to give per day? Why don't we go ahead and do that one first, and then I'll give you the other piece of it.
Right. So I'm assuming that the question is asking us what our goal is for our entire public health system. So right now we are past couple of weeks we've been getting just under 13,000 doses, and we have been giving them out the week that we've received them. So I would say that equates to maybe 2,000 doses collectively a day. There's no question that our system can do a lot more than that. There's no question that our system can do double those amounts. So I think to be clear, what we really want to be able to do is to increase our capacity as much as is necessary to be able to dispense the vaccines that we get as soon as we get them.
Okay. And the other question there was if if someone were to, let's say, sign up today on the interest form, maybe ours or somebody else's, how long should they expect it to be before they get notified?
That is a very difficult question to answer. They're partially because of the vaccine allocation. As Dr. Ariola said, we at this point have been receiving just under 13,000 doses a week, although we do expect that to increase per the governor's announcement. And so depending on what that increase looks like, we may be able to, we will be able to increase the number of people who are getting vaccines. And so we're trying to finish up phase our 65 and up, and we'll be starting to invite people in phase 3 and 4, but we're also using our partners. And so it's a little challenging to say exactly when, but just know that certainly we are moving through our list as quickly as possible based on the number of vaccines we receive. And again, hopefully in a few weeks, if we start seeing that uptick in vaccine allocations, we'll be able to get a whole lot more people in much more quickly.
And thank you, Elizabeth, to add to that, because to be clear, whether you are getting your vaccine at Department of Health and Environment's clinic, or you are getting it through the clinic for Olathe Health, Advent Health, Menora, or any of our health systems, you are getting your vaccine from the same pool that's coming to Johnson County. So they're not separate pool. Once we get the 13,000 dose we're talking about, what's coming to us collectively, that's what we are distributing and sharing based on needs. So and that's true also if you are getting your vaccine like we're doing with the Auburn Pharmacy or doing with Hy-Vee with some of the independent living. Moving forward, as more vaccines come, apart from the vaccine, which is a small amount that's going directly to pharmacies, there'll be more vaccine through us that's going to our pharmacies also. So no matter where you are getting the vaccine, you're getting from the same pool. Our approach remains the same. We want to create a scenario where there are multiple opportunities for you to get vaccines from multiple places rather than from 1, 2, or 3 places. That's what has allowed us to get to where we are with almost 180,000 shots. But that's the goal moving forward for a population our size, and also for convenience. That's to add to the number of providers. The vaccine are coming to the entire county, and you might be getting it through a DHE clinic or through one of our health systems or through pharmacy, but it's from the same pool.
Okay. I know we had a question that I wanted to save a little time for at the end about the variants. So about the COVID-19 variants, and a question about them being in our area. What can you tell us about that?
Right. So I'll start and then Elizabeth will come in. So viruses, in our case, we're dealing with what we call an RNA virus. They actually they change over time, which is what we call they mutate. Quite often, several of the mutations are really of no public health significance, meaning it doesn't add to it being more infectious or being more causing more adverse consequences. And so, but there are some that are being tracked across the world. I think some of that is what is the UK variant, or what we call the B117. There's the South African variant. There's the Brazilian variant, and there's some that have been found that are in different parts of the United States. Now, and so part of the caution that you're hearing from the public health community is if some of our vaccines being tested against the original or the wide variety versus the new variants. But if you really look at the trend of our numbers, even with the UK variant being found and really contributing more percentage to the prevailing prevalent species, our vaccines are still proving to be effective in suppressing death hospitalization. And so the UK variant has been found multiple times in Kansas, but I believe in at least the initial batch, most of them were found in within the same family. So that's that. But Elizabeth will also talk to some of the studies that's been done with a wastewater community where we're tracking the presence of that variant across Kansas and across the region, also on the Missouri side. And so there's no question that it's here. We've not really had one that's tested in a person that's identified in a lab that's a UK variant, but if it's found in other parts of the state and it's found in other parts of the country, we know that the likelihood of it being here is pretty high. And there are other indicators, Elizabeth, that it's already here, correct?
Absolutely. So as Dr. Ariola said, the way we find these variants is through sequencing. So as most of you know, if you've been tested for COVID-19, you get a swab up the nose, and then that swab can be, the virus that's on that swab can be sequenced, and you can find these different variants. And there are a lot of them. And particularly because this is an RNA virus, it replicates a lot. And with the number of people in the world who have been infected in the last year, uncommon that we're seeing as many variants as we are. There's sort of these favorable mutations that help it take a little bit more of a hold, like the UK variant, which is more infectious. So it means that a single person is likely to infect more individuals, a greater number of individuals than somebody who was infected with the coronavirus that was the dominant strain early on in the pandemic, or what's been here. So in Kansas, at least as of Monday, I believe, or the 11th, Kansas has identified, I believe, 30 of these UK variants, the so-called UK variants, throughout the state. We have not identified a variant in a person here in Johnson County, but part of that is because we don't send a lot of our specimens, a lot of those swabs, up to the state health department for testing. We do a lot of ours through private testing. And so it's only the state lab who's doing that sequencing. So we aren't sending the specimens there, so we're not really detecting it. But because we know this and we are interested, we have been working with Johnson County Wastewater as well as KU professors to look at whether or not we can identify any of these variants in sewage. And so when you go to the bathroom, if you have COVID-19, it is secreted there. And so we can actually take wastewater samples and sequence them and say, can we find the variant here? And what we know is we have been able to find that UK variant in a couple of different places since the beginning of January. But I'll say that they are seeing it at lower levels here in Johnson County than they've even seen in other communities. We also know that in Missouri, they've done a number of samples the same way and have found it in a variety of geographic locations. And this UK variant, because it is more infectious, it means it's more likely to become what we would call a dominant strain, or the primary virus that's being transmitted. And it's actually been detected in 49 states up until this point. So it's nothing surprising. It's really nothing to be alarmed about, but certainly speaks to the fact that we need to continue to do all of those public health interventions that we know work to prevent COVID-19 transmission, continuing to wear your mask, not attending large gatherings, trying to limit your gatherings of people outside your home, at least unmasked, meeting outdoors if you can, washing your hands, staying socially distanced. All of those things are as effective for these variants as they are for COVID-19 itself, the virus we've been dealing with for the past year. So we do have it. It's not it doesn't appear to be the dominant strain right now for Johnson County, but it is here and it is spreading. So, it's just about still doing all the things that we've been doing and getting the vaccine. As Dr. Ariola said, these new vaccines seem to be pretty effective against these other variants. So, we have the tools in our toolbox to prevent the spread. We just have to keep going.
And one thing to add, thank you for that, Elizabeth. One thing to add is, if you are not wearing mask or physically distancing, you are actually creating the perfect environment for the viruses to mutate. So that's how they do that, because the more infection, the more that they have, the more opportunity that they have to change. So all of these steps that we're taking is not just helping us prevent the adverse consequences. You're actually also helping against even further opportunities to mutate. So keep doing what you've been doing. Wear mask, physically distance. All of those steps are very, very helpful.
Great. Well, that was some new information for us. So thank you for the explanation and for sharing that with us. Any closing remarks before we sign off for today?
Yes, I want to say again that the non-pharmaceutical interventions are very effective, no matter the strain that we are seeing. Our vaccines are pretty effective too. The more recent one was tested against some of these variants and is effective. The previous ones are been tested, even though you might have some not as effective as before, they're still pretty effective. And the biggest indicator is, look at the numbers, look at the death, look at hospitalization, and look at reduction of severe illnesses, not just here across the country. The trajectory is showing that the vaccination is having an impact. So let's keep doing what we're doing. It's always good to have interest to keep up with the variants and other stories. For our case, our public health experts is just reminding us to keep doing what we're doing. It is working. We just need to stick with it for a little longer.
Great. Well, thanks so much to both of you for all of the information and for answering questions. The ones that we didn't quite get to today, we'll go ahead and make sure we answer those in the next day or so. So be looking for answers there. Allison, thank you so much for being our ASL interpreter today. Dr. Ariola and Elizabeth, thanks to both of you, and thanks to everyone out there watching and asking questions. We appreciate the engagement. So thanks and have a great evening.